This is the Hindu Rao Hospital in Delhi, India's capital. This hospital came into the headlines after reports emerged that a small group of doctors had threatened to resign from their jobs over the absence of safety gear, or what's called PPE, personal protective equipment. PPE has been a big issue for doctors across India when it comes to battling the spread of the coronavirus or the COVID-19. We decided to come on the spot to check what's actually happening. After talking to multiple sources, here's what we can confirm. 2 contract employees, 1 assistant professor and 1 junior resident doctor have indeed put in their resignation. These have not been accepted, but the bureaucrat in charge had this to say on Twitter. She was scathing in saying that unwilling workers were not welcome, especially in the time of a global pandemic. The government subsequently released pictures of doctors working in full safety gear at the Hindu Rao Hospital. But of course, the issue and the concern around safety goes much beyond this hospital. Most doctors, however, have not responded like these 2 contract employees. In fact, doctors are bravely at the front line, even given the fact that there is an acknowledged critical shortage of PPE or the safety gear they need. Basically, what we're talking about is a more evolved version of what I'm wearing. Gloves, mask, a face protection, goggles, and of course, the entire hazmat suit. And we know that these are in critical supply. So we reached out to doctors across the country and we put together a sense of what doctors everywhere are feeling. Some doctors agreed to come on record. Others were simply too terrified and they said that they could only talk to us on background. One senior doctor who did speak to us was an ENT specialist from Kolkata. Dr. Arjun was very blunt. He said doctors like him would never leave the battlefield, but he also knew that without proper PPE, this was virtually like signing a death warrant.
From our experience that we had in China and then Italy, Spain, America, and the news are coming from England, is a large number of health worker doctors, especially the doctors who are exposed to these patients unknowingly, are getting exposed to a very high to the disease and are suffering from the COVID-19 disease. And they are actually suffering from quite a severe form of this disease because of something called a viral load, because they are exposed to very high viral load. So sending the doctors to the front line, to the patients without PPE is a death sentence.
In fact, doctors tell us that they're using what's called Jogar to try and cope with the absence of adequate personal protective equipment or the safety gear that they need to ensure that they themselves do not get infected. This includes using polythene bags, maybe using raincoats, all kinds of things. There was even a report of one doctor having to wear a helmet to try and protect himself while dealing with patients. Doctors explain that in many cases, even where there is PPE available, it is not of the quality that they need. Doctors say that where they are receiving PPE that is at a 50 GSM level, what they actually need is a 70 GSM level ideally. To understand the importance of PPE, we also have to understand that it isn't just doctors and nurses who need them, but even those who are conducting tests, those who will come, for example, to collect home samples, all of them need PPE. So what's exactly happening? The manufacturers, the industry associations admit that this is giving them sleepless nights.
The lockdown has made it worse. Of course, we can't sleep. Most of us are having sleepless nights.
The other big concern is whether there will be transparency and access to the information of what's actually going on inside hospitals and with doctors. This is the Safdarjung Hospital at Delhi. And here we now have official confirmation of 2 cases among doctors that have been confirmed for the COVID-19. But around the same time, we've also seen a circular that says that all of the doctors who are admins of WhatsApp groups must pass on information of their mobiles, their emails, and other details that may be needed for onward communication to the police. When we inquired about and asked why this was necessary, we were told that this was to prevent the spread of fake news. Privately, doctors worry that this could result in some sort of de facto clampdown of information and basically discourage doctors from talking, even informally, about what's happening with the personal protective equipment to journalists like us. It's the smaller hospitals in the hinterland and in the non-metro cities that are actually the hardest hit by the shortage of personal protective equipment or PPE. But even at premier institutes like the All India Medical Institute, young resident doctors say that this is their biggest challenge and their biggest fear.
जैसा मेन इंस्टीट्यूट टेरिशरी केयर सेंटर्स है, पीजीआई, एम्स, जिपमर, ये सेंटर्स में प्रॉपर इंफ्रास्ट्रक्चर है, प्रॉपर मनी गवर्नमेंट जल्दी देगा, कुछ प्रॉब्लम है तो जल्दी करेगा, लेकिन जो नॉर्मल कॉलेजेस में है इसको कौन देगा, मतलब वो रिस्पॉन्सिबिलिटी किसका है, बहुत इश्यूज चल रहा है इसमें.
While the situation is both challenging and frightening for doctors and nurses and security personnel at hospitals and technical staff, imagine for a moment what their families might be going through at this moment, knowing that their loved ones do not always have the requisite safety gear that they need. This is an excerpt from a Facebook post of a man who's married to a doctor. We promise to not reveal his identity, but we're sharing his emotions just to give you a sense of the anxiety that these families are facing. He says people are more bothered about their quarantine routine and how difficult will this and that be, how they're watching Netflix and so on. I have never seen a more self-centered society than this. And he goes on to say that imagine if doctors were also self-centered and they refused to treat these people in case they too get infected. And this gives you a sense of the anger, the anxiety, the worry, the panic among these families. There have been many reasons for the shortage of the PPE. One, of course, is simply the scale of what we're dealing with here. But there have also been policy bottlenecks. The fact that there is just one nodal agency for procurement, and the fact that perhaps in standardizing what was needed, we lost a few critical weeks. Perhaps those of you who are not in the medical profession hear the word PPE and you tune out. You think it's some esoteric acronym. But remember this. If doctors begin to get infected, if doctors vanish from the front line, what will you and I do? As Rajiv Nath, the head of the Manufacturing Association, said, shame on us if we can't protect our doctors. But beyond the moral position, there's also the fundamental question. Who will battle the coronavirus if we can't keep our doctors safe?
We are ready, we are scared, but we are not going to leave the ground. And be ready. Please, please, please test more, because that's the only way we will know how far we are, what we are doing. The numbers are going to go up. That's okay. But test and isolate and give the health workers PPE. Please give us health workers. It's our very honest request to the government.